Good morning, friends. I'm Preeti Rajesh, Senior Physiotherapist in DPRZ. Today's topic is fibromyalgia and its management. The content, definition, pain etiology, triggers of fibromyalgia, investigations, communication challenges in fibromyalgia, sleep in fibromyalgia, fibromyalgia management, and references. Coming to a definition, defining fibromyalgia is not a simple task. It's like working on a jigsaw puzzle with pieces constantly being added and taken away. We are beginning to see the whole picture, but not all pieces of puzzle are in place. Fibromyalgia is not just a muscular disorder or even a form of arthritis, and fibromyalgia is definitely not a psychiatric condition. American College of Rheumatology definition of fibromyalgia syndrome. A history of widespread pain for at least 3 months. Pain is considered widespread when all of the following are present. Pain in the left side of the body, the right side of the body, below the waist and above the waist. In addition, there should be axial pain. Pain in at least 11 of the 18 tender point sites on digital pressure involving 4K of pressure. The sites are as below and bilateral and situated at the suboccipital muscle insertion at the anterior aspect of the intertransverse spaces between C5 and C7, at the midpoint of the upper border of upper trapezius muscle, at the origins of supraspinatus muscle above the scapular spines, at the second costochondral junctions on the upper surface just lateral to the junctions, 2 cm digital to lateral epicondyles of the elbow, in the upper outer quadrants of the buttocks in the anterior fold of gluteus medius, posterior to a prominence of the greater trochanter, on the medial aspects of the knees, on the fatty pad proximal to joint line. These are the prominent trigger points in that at least 11 of them should be present. And fibromyalgia is not only the pain, it can be associated with the pain, tenderness, fatigue, patient global multidimensional malfunction, sleep disturbances, along with that stiffness, depression, anxiety, dyscognition, etc. Associated syndromes are chronic fatigue, restless leg syndrome, irritable bowel syndrome, irritable bladder syndrome, cognitive dysfunction, cold intolerance, dizziness, multiple sensitivities. Epidemiology of fibromyalgia, it is approximate 4% of the world population. True fibromyalgia prevalence will be likely more than 50% higher. Prevalence increases with the age, genetic factor, first-degree relatives of the individuals with fibromyalgia display an 8-fold greater risk of developing fibromyalgia than those in the general population. Reported 4:1 female is to male ratio. That means it's more higher in females. Men self-medicate and do not seek medical care. Women more likely to meet classification criteria. Fibromyalgia can also affect children, teenagers, and the elderly. Fibromyalgia in children. As per the Eunice and Massey criteria for fibromyalgia in children, major symptoms are generalized musculoskeletal aching at 3 or more sites for 3 or more months, absence of underlying condition or cause, normal laboratory tests, 5 or more typical tender points. Minor, the poor sleep, fatigue, chronic anxiety or tension, chronic headaches, irritable bowel syndrome, subjective soft tissue swelling, numbness, pain modulation by physical activities, pain modulation by weather factors, pain modulation by anxiety or stress. So, what is the etiology? Pain in fibromyalgia results from an abnormality of sensory processing within central nervous system, referred to as central sensitization. As an analogy, central sensitization can be throughout as a turning up volume of an amplifier. Pain is more painful, and in some people, even being simply touched become painful. Likewise, a simple muscle contraction will be painful, and a delayed onset muscle soreness may be more amplified. So the pain will be more amplified in FMS. FM patients have high levels of neurochemical called substance P. When a person is injured, substance P is released into a spinal cord. If substance P is overproduced, the brain believes the body is in more pain than it really is. This is the diagrammatic description of fibromyalgia. Triggers of fibromyalgia. The cause of fibromyalgia is not known, but researchers have a number of theories about what causes or triggers the condition. Injury or trauma that affects the musculoskeletal system, injury or trauma that affects the nervous system, changes in muscle metabolism that cause fatigue and decreased strength, profound sleep dysfunction, response to an infectious agent such as a virus or bacteria, hypometabolism, and underactive thyroid or thyroid hormone. Investigations. No laboratory investigation confirms a clinical diagnosis of FM. Simple laboratory testing should be limited to CBC, ESR, CRP, TSH, or creatine kinase to rule out the condition that can present similar to FM. Sleep evaluation or formal psychological evaluation may be required in selected patients. Coming to the communication challenges. Patients with fibromyalgia may present with confusion, frustration, and even anger concerning their condition. It is not uncommon for patients to be dissatisfied with their medical care. It may take months to years for a correct diagnosis to be identified. Patients often see several physicians and are referred to specialists for further evaluation. As each alternative etiology is ruled out, the patient can become more and more anxious as they wonder what is wrong with them. This is compounded by the fact that some physicians are not familiar with fibromyalgia and others doubt its existence due to the subjective nature of the diagnosis. It is not uncommon for patients to encounter healthcare providers who dismiss their symptoms or downplay the impact of the disorder. Some healthcare providers may imply that the patient has a psychological illness, making the patient feel that it is all in their heads or not real. The patient might feel that their doctor does not believe them. I hope this picture is clear to everyone. We are really facing these kind of conditions in day-to-day in DPRC. Sleep in fibromyalgia. Affected individuals frequently report light, easily disturbed sleep and daytime tiredness, fatigue, or sleepiness. A self-monitored sleep-wake diary is a simple instrument that will reveal whether faulty habits result in insufficient or improper timing of sleep, causing sleepiness from physical fatigue where there is no problem with the scheduling or duration of sleep. The diary helps to clarify behaviors that may contribute to tiredness. For example, excessive use of stimulants, alcohol, sedatives, hypnotics, or consumption of street drugs. How to be a FMS survivor. Learn about the condition, accept that you have fibromyalgia. Learn to pace and prioritize activities. Try to remain positive. Try to reduce stress. Family and peer support. Learn relaxation techniques. With the help of medical professionals, develop your own home exercise program. Try to eat a balanced diet. Exercise as an intervention of individuals with fibromyalgia. During the exercise, what all things we should be careful? Aerobic exercise, walking, low impact fitness classes, and pool-based exercise programs are suitable for individuals with FM. To see gains in cardiorespiratory endurance, deconditioned individuals need to do aerobic exercise at least twice a week for a minimum of 20 minutes a day, moderate intensity strengthening. Strengthening exercises should not work on the same muscle groups on a consecutive days, and there should be a rest between each set of a given exercise in a single exercise session. Strengthening should also be done at least twice a week, so should not focus on the same muscle group in the consecutive days. All the patient will start complaining of pain and they will get demotivated and will stop the exercise. Stretching should be done to the point of mild resistance and not to the point of pain. Stretching or flexibility training may be beneficial as an initial means of exercise for those individuals who fear that exercise will produce intolerable increase in pain and fatigue. That's it, and these are my references. Thank you.